gentlemen, boys and girls, brothers and sisters, today we will be talking about pertussis, otherwise known as the whooping cough. First, we will talk about the signs and symptoms, then the etiology, reservoir, transmission, treatment, and prevention. So please sit back and enjoy the show.
At first you may just feel lousy, have typical cold-like symptoms such as runny nose, fever, coughing, but really you're experiencing the first symptoms of whooping cough. About 1 to 2 weeks after an individual's experienced the symptoms of whooping cough, they'll start to develop prolonged coughing spells so violently that it can cause vomiting, and sometimes individuals cough so hard they pass out. Whooping cough gets its name from the sound that the cough makes, the whoop sound, and it's usually in a child who experiences the whoop-like cough.
So here's a short audio clip that gives you a better feel for what pertussis sounds like and why it is known as the whooping cough. This little girl has expelled all of the air from her lungs and is now struggling to get air back into her lungs. Try to imagine being the parent or family member of this child.
The attacks of the coughing attacks, which also is known as paroxysms, usually can last for about 1 to 2 minutes, and in between they'll experience prolonged amounts of time between coughs where the person who is suffering from pertussis will appear to seem perfectly healthy and fine. And this is one of the main differences, one of the main characteristics of whooping cough. The coughing fits can last up to 10 weeks. The total time frame of a person with whooping cough can usually last about 12 weeks. Symptoms of pertussis usually develop within 5 to 10 days once the person is exposed, but sometimes not for as long as 3 weeks. Pertussis is a very contagious disease and is only spread by humans, person to person. People with pertussis usually spread the disease by coughing or sneezing, and then by them coming into contact with those germs. Many infants who get pertussis are usually infected by caregivers, parents, siblings, people who don't even know they have the disease.
Pertussis, taste the rainbow.
Today we are presenting on pertussis, also known as whooping cough. It is a disease caused by bacteria. The bacteria that causes this disease is Bordetella pertussis. The bacteria has a gram stain result that is negative. Bordetella pertussis is a small cocobacillus. This means that the bacteria is rod-shaped. It is also non-motile. Bordetella pertussis produces multiple antigenic and biologically active products including pertussis toxin, filamentous hemagglutinin, also known as FHA, agglutinogens, adenylate cyclase, protactin, tracheal cytotoxin. These products are responsible for the clinical features or signs and symptoms of pertussis. An immune response to one or more of these produces immunity following infection. Pertussis is primarily a toxin-mediated disease. The bacteria attached to the cilia of the respiratory epithelial cells produce toxins that paralyze the cilia and cause inflammation of the respiratory tract, which interferes with the clearing of pulmonary secretions. Pertussis antigens appear to allow the organism to evade host defenses. Lymphocytosis is promoted, but chemotaxis is impaired. Until recently, it was thought that Bordetella pertussis did not invade the tissues. However, the CDC tells us that recent studies have shown the bacteria to be present in alveolar macrophages. Humans are the assumed reservoir because we currently do not have any known environmental or animal reservoirs. Specifically, adults are most commonly considered the reservoir for the disease, since symptoms in adults are similar to a common cold. They do not realize that they are infected before spreading the disease to infants and children, in whom it can be much more serious.
The prevention of pertussis through vaccination is extremely important because of the seriousness of the disease in children. It also, once a person is infected with it, either adults or children or infants, you just have to wait out the symptoms, wait out the disease until your body can get rid of it, because there are no medications or antibiotics to get rid of it. Children are most at risk because they don't have much of an immune response to the pertussis bacteria. The elderly are also at risk because of the decreased strength in their immune systems. Pertussis is highly contagious. Antibiotics are given to prevent its spread. If pertussis is caught in its first stages, antibiotics can reduce the severity of symptoms. Treatment is mainly supportive treatment. Respiratory support is provided to support patients with pertussis when their heart and lungs are so severely diseased or damaged that they can no longer breathe on their own. Cough medicines in the form of syrups or pills have not been shown to give any relief and may even cause sedation, which worsens the disease. The vaccine to prevent pertussis in children is called DTaP. This is an acellular vaccine represented by the lowercase a, meaning the vaccine for pertussis contains only a part of the pertussis organism. The capital P means that it contains a full dose.
Negotiator!
Hello everyone, I'm here to give a little insight into herd immunity and its ability to protect our community. Herd immunity is a means of protecting our entire community by immunizing a critical mass of its populace. For instance, if you look at this graph with all the many people or pertussis reservoirs, you can see that the more that receive the immunization, those who are colored in yellow, the more protection the community has. This is especially important for those in the community that can't receive the vaccine due to age, pregnancy, poor immune system, etc. Obtaining immunity for the whole herd depends on the disease that is being targeted. Some diseases such as mumps, polio, smallpox, rubella require a much smaller percentage of the community to be immunized in order to obtain a herd immunity, somewhere around 80 to 85%. Pertussis, however, requires 92 to 94% of the community to be vaccinated in order to achieve herd immunity. This is due to its ease of transmission, short incubation time, and abundant reservoir. So, if you want to do your part in negotiating the spread of pertussis, you should consider getting immunized.
Pertussis Negotiator!
This type of vaccine is also an inactivated bacterial vaccine, meaning that the substance no longer produces disease. Instead, it empowers the body by causing it to produce antibodies that immunize it against future exposures to the pertussis toxins. The vaccine to prevent pertussis in adults is called Tdap. This is also an acellular, inactivated bacterial vaccine, but it contains a reduced dose of the DTaP vaccine for pertussis, as signified by the lowercase p. The pertussis vaccine is given in combination with the vaccines for diphtheria and tetanus. This is done to reduce the total number of shots a person must receive at one time. Ideally, children should receive 5 doses of DTaP throughout their growing years. The first should be given at 2 months, the second at 4 months, the third at 6 months, the fourth from 15 to 18 months, and the fifth from 4 to 6 years old. If children ages 7 through 19 were not fully immunized, they should receive 1 dose of Tdap instead of DTaP. Additionally, adolescents ages 11 through 18 or adults ages 19 years and up who never have received a Tdap shot should receive 1 dose of Tdap. Pregnant women should receive 1 dose of Tdap during each pregnancy, ideally between 27 and 36 weeks. Because immunity wears off over time, it's recommended to get a booster shot of Tdap every 10 years. In the 1990s, there was a change in the pertussis vaccination. Researchers believe that this change has resulted in recent national outbreaks of pertussis. Dr. Rachel Hurley, Deputy Director for the Division of Disease Control at the Colorado Department of Health and Environment, said, "What we've learned in the last couple of years is that the switch in vaccines has led to greater issues of waning immunity to pertussis, which means that the protection provided by the vaccine isn't lasting as long as we'd ideally like. Yet it is still true that children who are unvaccinated are 8 times more likely to contract pertussis."
This is Capital None here with a simple question. If the immunization is so successful, why are people not getting vaccinated? According to Dr. McCarthy, a pediatrician, there are several reasons people choose not to get immunized, which are usually based on myth or inaccurate data. Some people say it exposes you to the disease and could make you sick. This is not true. As mentioned before, the vaccination is made up of inactivated cells that are incapable of causing sickness. Some people also say that the illness is rare and not that bad. This is also false. Before the vaccination was available, pertussis used to infect over 200,000 people a year, killing more than 8,000 per year. Throughout the 1980s, less than 2,000 cases were diagnosed per year, with next to 0 deaths. Now, with more people opting out of vaccinations, as many as 48,000 cases are being diagnosed yearly, with nearly 40 deaths a year. Other people also say that the vaccinations cause autism and have side effects. Like any medical intervention, there is the possibility of side effects. Vaccinations, however, are rare and usually very mildly localized to the site of injection, and there has been no clinical data to support that autism is linked with the vaccination. Some people also say that the preservatives used are dangerous. Oftentimes the preservatives are the same used in a vaccine as what you would find in your food, except in a much smaller quantity. There's lists and lists of reasons people are choosing not to get vaccinated. But the fact is, with more international travel occurring and more people opting out of vaccination, rates of pertussis infection are increasing. Emphasis needs to be applied on the importance of staying immunized. It's not good just for you, but for everyone around you. This is Adam with Capital None. What's in your wallet?